Hi, AP Psych. This is Kate, and today I'm going to be talking about gender dysphoria. There's a lot of misinformation about this topic, especially since research is really new and science has a lot of unanswered questions. But hopefully, by talking about it, we can work towards reducing stigma and understanding the experiences of gender dysphoric people. So, first, here's a clip of a TED Talk I found with a transgender man talking about his experiences coming out.
And part of what was so nerve-wracking about coming out as transgender was knowing that people wouldn't know what I meant. And when someone comes out as gay, people know what that means. But when you come out as trans, you have to face the misconceptions that will color other people's impressions of you even after you've educated them. And you will have to educate them. When I came out, I wrote a 10-page encyclopedic document with a zip file attachment of music and videos that I sent to every single person I came out to. And I kept in my email signature for months afterwards, because you also don't ever stop coming out. I came out to the accountant helping with my taxes, and the TSA agents who didn't know which one of them should pat me down, the man or the woman. I just came out to everyone watching this.
And next, I want to develop some working definitions of the different vocabulary we're going to be using. First of all, we have natal gender versus experienced gender. Natal gender refers to sex, the identity a baby is assigned at birth, based on their external genitalia. We typically label babies with penises boys, babies with vaginas girls, and usually this doesn't cause any problems. But in some cases, experienced gender doesn't align with natal gender. Experienced gender being one's internal gender identity or your sense of being male or female. So, what's the difference between gender dysphoria and being transgender? Gender dysphoria is specifically the discomfort or distress that comes from a mismatch between natal and experienced gender. The DSM contrasts this with the adjective transgender, which, quote, refers to the broad spectrum of individuals who persistently identify with a gender different from their natal gender. Remember, dysphoria is the discomfort. So, do all transgender people have dysphoria? Not all on the same level. For some, they know that their natal and experienced gender don't match up, but it doesn't cause them that much discomfort. For others, their dysphoria is so severe to the point of depression, anxiety, suicidal ideation, and a host of other problems if left untreated. But are all gender dysphoric people transgender? Most, but not all. Some people experience gender dysphoria only for a short time in their life, so they might not feel the need to seek treatment. But for most gender dysphoric people, they will go on to live their life as their experienced gender. It's a lot to keep straight, but since every trans experience is so different, there isn't really like an all squares or rectangles way to put it. You may have also heard the word transsexual used before. It's kind of an outdated term, but it's typically used for trans people who have medically transitioned, like having surgery or something like that. But since not all trans people do medically transition, not all of them feel the need, not all of them are comfortable with that term. And also the word cisgender, it's kind of a newer word, but it's basically the opposite of transgender. In other words, anyone whose natal and experienced gender are in alignment. The DSM also frequently refers to this phrase, the other gender, as in like a desire to be the other gender. This is to leave room for trans individuals who fall somewhere on the non binary spectrum, rather than strictly wanting to transition to the opposite gender. I won't go into the specifics of non binary identities since there's so many, but it's important to understand that just because someone doesn't fall in the male female binary, they can still be transgender and still experience dysphoria. So, this is all straight from the DSM. We're just identifying the characteristics of gender dysphoria. For children, it's typically diagnosed after 6 months of symptoms and is specifically characterized by a strong desire to be of the other gender, or an insistence that one is the other gender. And then 5 of the symptoms listed here are also typically seen: wanting to wear clothes of the other gender or pretending to be the other gender, stereotypical activities, preferring playmates, disliking sexual anatomy, and having a desire for the sex characteristics of the experienced gender rather than what they're born with. And it's often accompanied by what the DSM calls clinically significant distress, so disrupting socializing, school, life functioning. And it's pretty much the same deal in adults, 6 months duration, incongruence between experience, gender, and sex characteristics, desire to be rid of sex characteristics, etc., and clinically significant distress is a big part of it. One caveat for adolescents and adults is if they are post transition. In other words, this is someone who already has been diagnosed with gender dysphoria and has been dealing with it. They've already transitioned, possibly had surgery. But again, just because you have surgery, it doesn't like magically make the dysphoria go away. This is something that for trans people can be a persistent issue throughout their whole life. So the case study I found is a snapshot of 4 families done by Kappas, Desilis, and Barron. They conducted a study of 4 families with transgender children, aiming to get a qualitative perspective on what day-to-day life was like for them, dividing their findings into the unfamiliar, preparedness, the future, and society. So, as for the unfamiliar, half the parents in the study didn't know the word transgender prior to having a transgender child, and they almost universally expressed regret and sadness, not because their child was trans, but because they didn't understand what they were going through sooner. As for preparedness, a lot of the parents discuss the difficulty in explaining the situation to their local communities because they don't want to draw attention or unnecessary stigma to their child, but at the same time, not explaining it can create a greater confusion. So it's kind of like a catch-22 for these families. And as for the future, parents had a lot of concerns about the affordability of transition as their children approached puberty. One father voiced his concerns for his daughter's impending interest in boys, fearing that she would be rejected or abused for being transgender, which is something that we see in the media a lot. And on society, a dad in one household that had 2 fathers discussed how some people who were perfectly acceptable of he and his husband being gay and raising their kids were not accepting of his daughter being transgender. And ultimately, the conclusions that the study drew were that family acceptance predicts greater self esteem, social support, and general health status. It protects against depression, substance abuse, and suicidal ideation and behaviors. Therefore, a child's health and happiness begins at home. So, some explanations of the factors behind gender dysphoria. The exact cause is unclear, but the National Health Service provided several theories, among them being hormone imbalance, which could be caused by hormones in the mother's system if she was taking drugs, like certain hormonal drugs during her pregnancy, or could be caused by the fetus having some kind of genetic insensitivity to certain sex hormones. But there still isn't a consensus about what exactly causes it. A study by Polderman concluded that gender identity is a multifactorial, complex trait with a heritable polygenetic component. Basically, they were saying gender identity is heritable at a similar rate as any other behavioral or personality trait. Um, and as for environmental and cultural factors, males with gender dysphoria are more likely to have older brothers, which again could be something that relates to hormones in the mother's body when she's pregnant. Child abuse and other trauma can also advance or contribute to gender dysphoria. And it's important to note that many cultures around the world have pre scientific concepts of diverse gender identities, such as Hawaiians, Tahitians, Dene Native Americans, and more have long held traditions of non binary identities. So, for the presentation and continuation, cross gender behavior usually begins to present from ages 2 to 4, but there's very little research on the experiences of prepubescent dysphoric children. Because a lot of people don't realize that they're trans until adulthood, some even as late as their 40s, 50s, or 60s. So science is often working with vague recollections of childhood rather than concrete evidence. Criteria for children are more concrete than those for adolescents and adults because teens and adults are more likely to have the language for what they're feeling. For kids, we have to rely on how they're acting because they don't always know how to describe what's going on in their heads. As for the persistence of gender dysphoria from childhood to adulthood, it's very variable. Some studies put it at 2.2%, others at 50%. So the DSM emphasizes that it's really unclear what the impact is of children being encouraged to live in their desired gender. And it also seems that gender dysphoria can develop around puberty or much later in life. Some transgender adults report experiencing gender dysphoria during childhood, others don't. So now, what gender dysphoria is not. So first of all, intersexuality, and sex development disorders. Those with sex development disorders are likely to exhibit gender atypical behavior, but in most cases, they won't experience gender dysphoria specifically. As for gender nonconformity, this is basically the difference between gender expression and gender identity. An individual can be cisgender and have no gender dysphoria, but still express their gender in an unconventional way. For example, a girl can have masculine interests without actually wanting to be a boy. As for body dysmorphia, gender dysphoria has a specific tie to gender that body dysmorphia does not. Someone with body dysmorphia doesn't necessarily want to change genders or have any discomfort with their gender. And now, schizophrenia and psychosis. Some people with schizophrenia may have a delusion of belonging to another gender, but gender dysphoria itself is not a delusion. It's very real for those who experience it. So, what are the long and short term consequences of gender dysphoria? In day to day life, kids can experience social isolation, they can have difficulty forming friendships, teasing, harassment, and especially discomfort from being forced to live as their natal gender. For adults, they can have discomfort with intimacy and sexual relationships. On a daily basis, they face stigmatization, discrimination, victimization, which can all lead to low self esteem and increased rates of other mental illnesses. So, for someone with gender dysphoria, being forced to live as their natal gender rather than their experienced gender can have disastrous consequences on their health. Transgender children being raised in a hostile environment will often respond with, quote, symptoms of depression, anxiety, fear, anger, self mutilation, low self esteem, and suicidal ideation. For some dysphoric people, it is the social stigma and rejection from friends and family that is more painful than the dysphoria itself. In one study, nearly 50% of transgender youth had serious suicidal ideation, and 1 in 4 had actually attempted suicide. That number is closer to 1 in 3 in more recent studies. But even a supportive family can't always alleviate the pain of the intense social stigma that exists towards trans and dysphoric people. The Human Rights Campaign has tracked violence against transgender people since 2016. 26 murders were identified last year, with 4 so far in 2020, and that's people who were killed specifically because they were transgender. I definitely encourage you to pause the video and take a look at some of these statistics. They're very upsetting, but it's also important to see them to understand the extent of discrimination that transgender people face. So, what treatments are there available for gender dysphoric people? First up, we have hormonal replacement therapy. Hormone medication typically suppresses the hormones of the natal gender or induces hormones of the experienced gender. For example, a natal male with gender dysphoria might take testosterone blockers and estrogen stimulants. Hormone therapy operates mainly on the secondary sex characteristics such as distribution of hair, muscles, and body fat. The second option is gender reassignment surgery, sometimes called gender confirmation surgery. There are a lot of different surgeries available to trans people. It's not just one. There's top surgery, bottom surgery, facial feminization, masculinization, and more. But most trans people will only ever get one, if any, because they can be really expensive and insurance often doesn't cover them. Therapy is also really helpful for gender dysphoric people in terms of encouraging self-acceptance, addressing social and legal issues, and navigating relationships with friends and family. And lastly, there are quite a few do-it-yourself type solutions that many people use to reduce gender dysphoria, such as voice training, hair removal, tucking or packing, and chest binding. Finally, it's really important to remember that every gender dysphoric person is different. Some will want hormone treatment, some will want surgery, some both, some neither. If you meet someone who trusts you enough to tell you that they're transgender, you shouldn't assume that you know anything about their body or their identity based on that fact alone. By educating ourselves in our communities, we can work together to reduce stigma about gender dysphoria and transgender people, and get them the support that they need to live their fullest lives.